This is the statement document on behalf of the European Medical Association. At the WHO Europe Oslo Medicine Initiative, WHO Regional Office for Europe. The European Medical Association, and the role of the European Information and Education Actions, for favoring better access to effective, novel, high-priced medicines. Which vision for collaboration between the public and private sectors. The focus is on united action for better health in Europe. The statement presented by Guglielmo M. Trovato, Professor of Medicine at the School of Medicine of the State University of Catania, Italy, Director of the Media, E-Learning and E-Medicine Bureau at EMA, Brussels. The background. EMA announced the Oslo's Medicine Initiative with a news published in the EU Commission Educational Platform, EPAL. This area of focus for WHO/Europe's core priority of moving towards universal health coverage is shared with other European initiatives, such as the proposal of revision of the EU General Pharmaceuticals legislation. The EU Pharmaceuticals strategy, and drawing lessons from the COVID-19 pandemic, is displayed also by Commission plans to evaluate and revise the EU's general legislation on medicines, aimed for human use to ensure a future-proof and crisis-resistant medicines regulatory system. The revision will aim to ensure access to affordable medicines, foster innovation, including in areas of unmet medical need, improve security of supply, adapt to new scientific and technological developments. The Oslo's Initiative. The goal of Oslo's Medicine Initiative is supporting member states' efforts to ensure access for all to medicines, vaccines and health products, implementing World Health Assembly Resolution WHA 72.8 on transparency. The objectives are to consult with non-state actors to understand different perspectives on access to effective, novel, high-priced medicines, particularly relating to the current roles and responsibilities of the public and private sectors, and receive input on the proposals for the Oslo Medicines Initiative set out in the draft scope and purpose and discussion documents. The current framework has several critical points, variously perceived and conceptualized by doctors and other health professionals. Our contribution is addressed to this unmet set of information regarding the views of European medical doctors, not represented elsewhere in such processes and debates. The European Medical Association is a not-for-profit more than 30 years old organization, with expertise in drafting analysis and policy briefs, joining professionally and scientifically qualified members. Their shared background is clinical, that is medical practice and teaching at high postgraduate levels, not based on specific management or administrative expertise. Such features of the contributors potentially and reasonably needed and useful are not explicit even in the document explaining what the European Health Emergency Preparedness and Response Authority, HERA, will or would be, and these features should be well represented, in our view. The European Medical Association may provide contributions, based also on its international experience, networking and knowledge, as detailed in the 2 articles on Green Pass for sharing recognized COVID-19 vaccine certification, easing free circulation of people in Europe. The EMA's monthly workshop of 24th March 2021 and the other one, the 30th of November 2020, the challenge of distilling effective and appropriate targets for enhancing innovation in economy, society and science education in Europe.
Basic data. To reach a shared level of information on the field experience of doctors belonging to EMA, we have developed and distributed among our member associates a questionnaire. This is the basis of a basic survey, focusing on 3 key issues, presented below as a synthetic analysis of answers. Better informed doctors make better treated patients. The current opinion among the interviewed is that the patents are barriers for drugs and vaccines, being disadvantageous element for public health in the world and therefore for the world economy. Most interviewed answered that the patentability of drugs is a condition that can be abolished or mitigated, at least in some specific cases, and this is considered not detrimental to research and the quality of drug production. For most interviewed, it is not clear if there are already legal spaces that, in emergency conditions, such as the current pandemic, allow the free production of patented drugs. A very short period of validity of the patents themselves, namely a few months, 1 year, should be considered, reducing or eliminating in the meanwhile cost of the related royalties. Conclusion. One of the position points that EMA already agrees inside its working groups refers to promote sustainable global health ethics and transparent economy strategy. Political ethics and economy must enhance free cultural interactions at the level of study, research and medical procedures, assuring everywhere and for everybody freedom, human rights for life and health, free mobility, also allowing access to the better possible care. EMA endorses any effort for joining medical professionals for assuring affordable delivery of innovative and salvaging medicine as a primary preventive tool, beyond the barriers of patents, if any. Mostly relevant is that European and national governments clarify if there are already the international legal conditions, secured by international treatises, which will allow overcoming the barriers of patented drugs, at least in specific conditions, and still guaranteeing the appropriate gains to producers. Such concepts and information need effective dissemination actions, including a greater specific focus inside the educational academic schemes, such as the Erasmus actions in Europe. Most teaching actions are still transitorily substituted by e-learning courses and platforms, and are suitable for spreading information actively among members, followers and any sensitive social media network.